Next, I'm going to conduct an ears and nose assessment. So I'm going to inspect my patient's ears, noting their auricles have no redness, tenderness, swelling. There are no piercings noted. I'm also going to stand directly in front of my patient to make sure that their ears are symmetrical with the patient's face. Next, I'm going to conduct the voice test. So I'm going to stand behind my patient and I'm going to ask them to cover one of their ears. And I'm going to whisper a couple words, and if you can go ahead and repeat those for me.
Act. Apple, orange.
If you can go ahead and cover your other ear.
Banana, pineapple.
Patient was able to identify the words used. Testing cranial nerve 8. I'm going to conduct a Weber and Rhine or Rhina exam. You will be conducting both examinations. We are utilizing a tuning fork, so you're going to be sure to hold the tuning fork at the very base, making sure that your fingers do not touch either portion up here because that will alter the vibrations being conducted to the patient. So you will initially hit your tuning fork and you will place the tip of the tuning fork directly in the center of the patient's forehead at their hairline, and you're going to ask the patient if they're able to hear and feel the vibrations equally in both ears. Let me know when it stops. Okay. Were you able to hear and feel the vibration equally in both ears? If the patient was unable to hear or feel the sensation in one of the ears, you would be conducting the Rhine or Rhina examination on the affected ear to identify the air conduction to bone conduction. In this case, we are going to continue on with this exam, and you can just select an ear to assess your patient with. You can have your patient turn their head slightly, and I will be timing this. You want to make sure you're not wearing an Apple Watch. You want to make sure you're wearing a watch with the second hand so you're able to identify the time. I am going to set my timer. So I'm going to be placing the tuning fork onto the mastoid process. And once you do not feel the vibration anymore, let me know. And I'm going to move my tuning fork to the ear, and you can let me know once you do not hear the sensation anymore. The air conduction to bone conduction should be 2 to 1, so you should be able to hear it twice as long as you should be able to feel it. So I'm going to make sure that I have my watch available, and I am going to time this. Let me know when you can't feel it. Again, I'm placing the tuning fork onto the mastoid process.
I can't feel it.
Note 15 seconds. Note 49 seconds. So again, the patient has greater than 2 to 1 air conduction to bone conduction when performing the Rhine examination. Next, I am going to assess my patient's nose. I am making sure that my patient's nose is midline. Do you have any difficulty breathing? No. I am going to make sure I have all my supplies. I'm going to grab my pen light. I'm making sure that the nose again is symmetrical. There are no lesions, no tenderness. I'm going to palpate the patient's nose. You can put gloves on if you need to. Any pain or tenderness?
No.
I'm going to have my pen light, and I'm going to look into the nasal cavity to make sure that the septum is midline and not deviated. I'm also going to test for patency, so I'm going to place my hand below your nose if you can just cover each nostril and just breathe. You can go ahead and cover the other nostril. I'm identifying that air is moving freely within the nasal cavity, and there is no drainage, no lumps, abscesses. Do you have any bloody nose? Ever had a bloody nose before? No. Okay. And lastly, I'm going to assess my patient's sinuses. So I'm going to start with frontal. I'm going to place directly underneath the eyebrows. You can use your thumb or you can use your fingertips, noting any pressure, pain. Do you have any pain when I press there?
No.
And then lastly, I'm going to assess my maxillary. Any pain or tenderness?
No.
Also, I would have noted as well when I was assessing my patient's ears that there were no drainage, foreign bodies. The patient didn't demonstrate any difficulty hearing at this time. And that is the end of ears and nose.